Good evening, everybody. Welcome to another episode of Mondays with Maishi. This is Maishi Norman out of Lakewood, New Jersey. It is December 1st, 2025. Can you believe that we're still doing this? Just after 9 o'clock p.m. here in Lakewood. And we are honored to have I think it's third or fourth time presenter, Dr. Klafter out of Cincinnati, Ohio. Dr. Klafter is a psychiatrist and a psychoanalyst and a very broad-minded, well-read fellow and great resource here in the psychotherapy community. So for those of you who haven't heard him yet, get to know him. For those of you who have heard him, that's probably why you're back here to listen again. Very interesting, very informed, and lots of fun. So Dr. Klafter, thank you very much for agreeing to do this talk tonight, as you have in the past, and for joining us and taking from your time.
My pleasure. Nice to
And
see you again.
yeah, and tonight's topic is the topic of the formation of personality disorders. I think that this is something that is so vital for us to understand. You know, besides the spectrum of personality disorders that there's what used to be referred to as cluster A, cluster B, cluster C. There's also, I believe, and you'll correct me if I'm wrong, but a spectrum within each personality disorder. People can have what they call traits of a personality disorder. They could have what people might refer to as full-blown diagnostic personality disorder. And, why does it really matter? I mean, you're not ever medicating a personality disorder. It matters, obviously, for the people around them who are struggling because of the personality disorder, as we'll get to learn about what that means. And it, of course, also matters as to how we understand and conceptualize, especially if we're doing insight-oriented therapies. We start to conceptualize what was the trajectory? How did this happen? What was the formation, the evolution, the development of these symptomatic behaviors, reactions, feelings that are so intense and strong, and how they came to be? So, Nachum, I hope that we can talk about this tonight a bit. I also hope that those of you who are on can grace us with turning on your videos if that's an option, as we ask every week. And for those of you who have questions or comments, to please click the React tab on the bottom of your screen and raise your hand, and we'll call you in due time. So, Dr. Klafter, again, thanks for joining, and take it away. Let's start. I just want to ask you first about the formation of personality disorders. There's that million-dollar question of nature versus nurture. And I know we're going to talk about, obviously, attachment styles and how people begin to develop their personalities based on attachment styles. But is there a component of propensity, where like I am born as a sensitive child, my sensitivities, like we talk about in the drama of
Right,
the
so I'm gonna talk about temperament also.
good.
I'm gonna talk about temperament. You said, I'm gonna talk about attachment styles, but that's only one of the theories and components of personality. Attachment is one ingredient too. Um, so yeah, it's nature and nurture. We have more control over nurture, so we think more about nurture, but understanding nature helps us with treatments also. So it's important to think of temperament and biology. So the formation of personality disorders is really the formation of personality. So when you talk about like how are personality disorders formed, you have to think about how personality is formed. So we also have to define, so that means we have to figure out like what is personality and what's the difference between a personality and a personality disorder. So there are different theories of how personality is formed, and that means that those same theories determine how personality disorders are formed. So we're going to go over the major ideas, and I don't intend for this to be like a theoretical discussion. I intend for all this to really be very practical, and I'm going to try to talk about everything in very like ordinary, normal language and not use esoteric theoretical terminology. If I fail to do that, please chime in, and I'll count on Moishi to interrupt me if someone has a question about what I'm saying in that moment. So, personality is the unique set of ways that you interact, feel, interpret yourself in the world. Um, the the American Psychiatric Association in the diagnostic manual has developed something called the general criteria for personality disorder. And it's based on the 4 dimensions of personality. You know, there are like 4 realms of what we think of as someone's personality. When we talk about personality, we're talking about the enduring way that someone is all the time in a variety of different settings. It's not the state someone's in when they're depressed or the state someone's in when they're intoxicated by a substance. Someone can look very different when they're in a certain state, but these are enduring traits that are always with the person. And we think that it's formed by late adolescence and it endures into adulthood. Personality does change. Personality can change. It's actually surprising the degree to which people that we know, that we knew very well when they were little, if you don't see them for many, many years and you run into them 20, 30 years later, how much they've grown and changed. Certain things don't change, certain things do change. Most people's personalities get better and more mature and softer and more flexible over time. Most people do get healthier over time. Therapy can hopefully catalyze that process so that you can mature, get healthier faster. But personality continues to evolve through adulthood. The personality disorders are like extreme versions of different personality styles. So you said at the beginning about there's like a spectrum within each disorder. What I think about it is there are different styles of personalities. And then if someone has very extreme traits that are very inflexible in that style, we call that a personality disorder. But the 4 dimensions of personality are the following. They are interpersonal relationships, cognition, which doesn't mean like your memory or your attention span or your digit span. It means the way that you interpret and see yourself with others, like cognition in the way of like cognitive schemas, the way we talk about in cognitive therapy, impulse control, and then what the DSM calls affectivity, which means the way that you respond emotionally to different stimuli. Some people are very, very dramatic and have very strong reactions. Some people are very muted and sort of almost dead and they don't react very much. That would be a simplistic way. Are there characteristic ways that you react emotionally to things? Those 4 dimensions, if you think about any person you know and you would describe those 4 dimensions in like a little paragraph, that would be like a nice summation of their personality. And a personality disorder is when you have problems in 2 or more of those areas that are strong enough or severe enough that they cause problems in your ability to function academically, professionally, or socially, or they cause a lot of subjective distress, and that those traits that you have in those areas seem to be sort of out of bounds with what's expected in the culture to be pretty normal. So in different cultures, some personality attributes can be considered sort of, more acceptable than others. There are some cultures where being very authoritarian or very class oriented or very imperious would be considered like normal. In cultures where there's like a very embedded caste system, or where there's, there are like built-in cultural statuses that people have, those cultures can tolerate a lot of harsh authoritarianism that in our culture, in a Western liberal culture, we would see as like really off-putting. And so it's important to be culturally sensitive. That's one example. There are many other examples. I think that there are things in our, religious Jewish cultures that are different in expectations than the rest of the society around us. So we try to be sensitive about cultural issues, but the traits are sort of, that we think of traits as being extreme and also being rigid. If I am a military officer, I need to be able to be, assertive and authoritarian when I'm at work with the soldiers that are subordinate to me. But I also need to be able to take orders from a higher commanding officer. And when I'm home with my children and my wife, hopefully, I'm not using like the same model of submission or authority that I am while I'm in the military. If I would, that would be a personality problem. That personality problem is less evident while I'm, at work in the army than it is when I'm at home.
Which
But
may very well be why people are hired to those positions, because oftentimes they are the right person, or they seem ostensibly the right person for that position because they can carry that command.
well, a healthy personality should be able to do that when you're at work and not need to do that when you're at home. I mean, that's what a healthy, flexible personality should be. It's true that certain personality types will be tolerated more in certain roles. People that are very arrogant, very grandiose, very, hungry to be the center of attention, that's tolerated in the entertainment industry. But we see that a lot of those people have personal lives that sort of blow up because of those needs. So a healthy personality can be flexible. You're able to adapt in one setting versus another. So what are the theories as to how personality forms? There are basically there are basically 6 different theories, is what I'm going to say. There are 6 different theories as to how personality forms. One of these theories is actually from the field of cognitive therapy, and it's learning theory. Learning theory. The other theories are really in the realm of psychodynamics or psychoanalytic theories of personality development, and they also differ from one another. I am going to try to explain each of these approaches briefly and sort of practically, like give a quick overview. And I'm going to try to do each of these theories justice on their own terms. Then I will at the end sort of talk about my own view, what makes the most sense to me. So we'll start with cognitive therapy and the cognitive approach. The cognitive approach is that the core of personality is actually what's called a schema. And a schema is, as a lot of you know from your studies of cognitive therapy, a schema is a view or perspective of how you fit into the world, how people look at you, how people treat you, how people feel about you, what your role is with them, what your obligations are to them, how they will respond to you if you live up to that role or don't live up to that role, what your expectations are, what the consequences are. And that develops according to learning theory through like kind of anything else we learn. It is built through a series of cognitions. Like you don't start with a schema. There are little cognitions. For example, if a child learns very early on, if I get angry or lose control of my emotions, mommy will hate me, or daddy will be angry at me. Or in a different kind of house, if I get angry, mommy will get depressed and go to bed for months in a row. Or if I'm hard to deal with, mommy and daddy won't get along and they'll get divorced. That might be like a cognition that a child learns. Now, the way a child learns is by definition sort of childish. So the way a child learns these things is going to be necessarily distorted, exaggerated, probably very self-centered, because children do something and see a consequence and they assume that the consequence is due to them. So children learn sort of exaggerated distortions. And the other thing is the things that we really learn are the things that are dangerous. So a lot of cognitions that have a lot of impact on one schema are sort of danger signs. If I do this, or if I fail to do this, this will happen. Or signs of reward. When I do this, this will make mommy and daddy very happy. They will love me. They will feel good about me. They will reward me. I will be appreciated. Things will go well for me. And so this is not really necessarily a contradiction with all of the analytic theories that we're going to talk about. What's really different about it is that in cognitive theory, the process of learning one's cognitions and therefore building up a schema is actually rational. It's rational learning like other learning. It's classical conditioning, operant conditioning, the different mechanisms of conditioning. There are people that tried to do research about, developing a more elaborate theory of personality from cognition. I studied this literature a little bit when I was in residency. It's difficult to really put together an elaborate theory of personality based on cognitive therapy and cognitive psychology. But there's no question that our sort of intuitive common sense view, when we see people that have personality problems or seem to be doing the same wrong thing over and over again, the first thing we do, sort of with a common sense approach, is identify there's some cognitive distortion. There's like this automatic thought that is really, there's this automatic thought that is just so distorted and so problematic, and we try to talk them out of thinking that way. That's the way we give advice to our brothers or sisters, to our friends, to our children. So there's something very like sort of common sense or intuitive about cognitive psychology and cognitive distortions. This is, I would say, also one of the more accessible ways to think about personality formation, because cognitive distortions are kind of easy to identify. As you're talking to someone who says, let's say you're treating a patient who's really, really shy and really, really lonely. Like they suffer from diagnostically maybe social phobia, and underneath that would be an enduring pattern of, we'll say, avoidant personality disorder. It's easy to identify where their thinking goes wrong. Like if you would say to them, like, why aren't you going to this party you're invited to? They'll say, well, everyone there is going to be annoyed by me. Everyone's going to be bored with me. And that's a distorted cognition. So that's sort of like one of the first pieces that we see. So there's really something very helpful, I think, in identifying the cognitive distortions that people have. And that is one of the building blocks of personality formation. And I don't think that any of the other views, which are drive theory, ego psychology, object relations, self-psychology, and attachment theory, that any of those other views really disagrees with cognitive distortions. It's just that they disagree about how they were formed. They weren't formed according to these other theories by like sort of a rational learning. So to get back to some of the other theories,
I'm curious, in cognitive
yes.
theory here, you're talking about rational learning, but many of these things are developed way before a child has the capacity to think. So it's sort of happening through observation of the social cues given by his or her primary caregivers.
Well, listen, a lot of the learning models for cognitive psychology were developed with animals. I mean, we're not talking about.
So what is
when I
it?
say
What exactly does it
rational,
mean? Yeah.
when I say rational, I don't mean that it's like high level philosophical logical thinking. But what I mean is that if someone every time they push a lever, they get a certain stimulus.
Mm-hmm.
They learn that pushing that button will get that stimulus. That is like a rational conclusion. It's
That's not an affective experience, meaning each time my parent frowned at me or my parent got overwhelmed when I cried and wailed, I felt the disappointment or I felt this deep sense.
So according to cognitive psychology, the stimulus is an emotional stimulus, but it still follows from what the child imagines they're doing to get that stimulus.
Mm-hmm.
And what's childish or what's distorted is that the child doesn't recognize that, like, mom was suffering from major depressive disorder,
hundred different reasons that she's behaving the way she is,
or an opiate addiction, or dad had a serious anger problem, or dad was being tormented at work, or dad has PTSD from being bullied as a child. That's much later in life, and usually in therapy that people figure that out. But so the emotions are one of the stimuli according to cognitive psychology. That's what they're learning, that emotional stimulus. So now I'm going to move over to the psychodynamic or psychoanalytic theories of personality formation. And we really have to see all of these as complementing one another, I think, and also complementing cognitive science in a way. So the first theory of personality formation was really centered around early childhood experiences and how we tame children to stop just giving into their biological urges and learn to control their impulses and learn to interact socially and internalize the rules and values of the society around them. So, the view is sort of a child is born as kind of like an animal, but this animal is wired to learn to become social. And the theories that were developed in this first stage of psychodynamic thinking, which started about 125 years ago or so, that's about how old this was, were that the child learns and develops as the child is developing, that his or her impulses are dangerous and need to be reined in. And in reining in these impulses, the child usually overcorrects for their impulses and develops all sorts of anxieties and inhibitions. So, for example, children all have, according to this theory, innate aggression. They have innate aggression. They have the wish to be powerful, to win, to dominate others, to take what they want, to push other people out of the way, to grab it from other people, and assert what their needs are. And they very, very quickly, sometime before age 2, start to learn that if I just bite and claw and take whatever I want to, the people around me that are much more powerful than me and that I need to take care of me are going to be very, very unhappy with me. And so, without thinking about it in any way, they develop ways to rein in their urges. And they also develop ways to stop their thoughts from going in directions that cause distress. So this is what sets up the dynamic unconscious, which is the term we use for the aspect of my personality and my wishes and my needs that I need to keep outside of my awareness for my own safety, for my own comfort, and just so I can sort of get through the day thinking rationally. The major impulses that are being regulated are the impulse to feel physical pleasure, which was called libido. That includes eating food. It also includes physical sensations that are pleasurable in your body. It eventually includes sexual sensations. So the pleasure-seeking part of me and also the aggressive part of me. That the real task of life is sort of taming the beast. How do children rein in their impulses? And the ways that they rein in their impulses, there are many different styles that people rein in their impulses. And that, according to this theory, sets people up with strengths and vulnerabilities for their whole lives. There are people that are always afraid to assert themselves. There are people that assert themselves too aggressively. There are people that are afraid of seeking pleasure. There are people that seem to be insatiable in the way that they seek pleasure. And this first wave of psychoanalytic thinking looked to early childhood and how children are socialized. And it really paid a lot of attention to like ages, we'll say, 2 to 12, something like that, between ages 2 and 12. And it's not that they didn't believe that personality can be formed after that or modified. It's that that's what they were studying, that's what they were looking at, and that's where they felt a lot of the problems were started. So the personality problems that are explained by this form of theory about personality are the personality traits that have to do with your pleasure-seeking needs and your aggressive, assertive needs either not being in check or being too inhibited. Those aspects are explained by the drive theory. The next theory that came along is a modification of drive theory, which is called ego psychology. And what that means is that it's not simply that we rein in your aggressive and pleasure-seeking needs. It's that you develop tools in your mind which actually allow you to gratify those needs in a manner that is also productive and contributes to your family, to your relationships with your friends, to your society, that you can earn a living doing it. So, and that goes on over a much longer period of time. That doesn't just happen, between ages 2 and 12. That happens, over the whole life cycle. Erik Erikson was one of these thinkers, and most of you from your studies in psychology know that Erikson came up with stages that go all the way through life, from infancy all the way to the end of life. It included thinkers like Rappaport and Heinz Hartmann and Anna Freud. And it looks at the way the mind continues to mature and the way, again, we can sort of harmonize our personal wishes and needs with our obligations to the outside world. So this includes additional personality problems than the first theory. It's a more sophisticated, more elaborate scheme. The third wave of theories, which actually started simultaneous with ego psychology, but it developed mostly in Britain and then later in the United States, is what's called object relations theories. Object relations theories are theories, it's terrible terminology, object relations. What it means is that the way we internalize our relationships is our personality. So the way my mother and I get along, the way my father and I get along, the way my brothers and sisters and I get along, the way my teachers get along with me, that sets up in my mind an internalized model for who I am, who other people are, and how we get along. And the way we describe the mind in object relations theories is not, through all these structures, the ego, the id, the superego, the ego ideal, the defense mechanisms. The way we think about the personality structure is actually, how do I see myself? How do I see others? And how do I imagine myself and others interact? And one of the key components to this theory is actually about learning. It's that under low affect conditions, meaning low emotion, and so I think this may be what Moshe Norman had in mind at the beginning with this question, is that under low emotional, low affect scenarios, we learn rationally, logically, like we learn our multiplication tables, we learn things about the world. You could learn, if you apologize to someone in a certain way, that apology will be more accepted. You could learn that if you say please before you ask something, you could learn rationally that when someone's talking, try not to interrupt them, try to listen to them. You can learn certain things rationally that will help you. If anyone's ever seen the book How to Win Friends and Influence People, that's a good example of someone trying to use rational learning to teach you how to interact. But under high affect, high emotion scenarios, we learn in a very different way. In high emotion scenarios, that's when we embed in our mind the view of myself, the view of others, and how we get along, how they feel about me, how I feel about them, if I do a certain thing, how they're going to respond. This is really sort of like, in my opinion, object relations theories fits really well with cognitive therapy or cognitive psychology, because object relations theories explain why the distortions take place. It really explains why these overgeneralizations and fears kick in terms of people's personalities. The major thinkers for object relations theories, it started with really Melanie Klein. In England, it was also Fairbairn and Guntrip. And then later in England, the followers of Melanie Klein, it includes Rosenfeld, it includes Joseph Sandler, it includes, of course, Winnicott, who was sort of a middle group who included some things from Anna Freud and also from Melanie Klein, but he really, I think, should be better understood as a is a disciple of Fairbairn and Guntrip. And in America, Otto Kernberg was one of the most important object relations thinkers. And then it became just kind of part of mainstream psychodynamic thinking. And object relations thinking is now, often the core of most of the psychodynamic curriculums that you'll study in an advanced psychotherapy program or analytic training at an institute.
I've tried to get him on the show so many times. If anybody has any kind of relationship, or I don't know if he's still practicing or
He's still speaking.
he
He's
does.
still speaking. I don't know how active he is right now. He's getting up there in years, but I can look into that for you. The next set of, and by the way, object relations theories is really the most helpful at understanding, I would say, borderline personality disorder and borderline states. We can talk about that a little bit. The next set of theories is the most helpful in understanding narcissistic personality problems. The next set of theories was founded by Heinz Kohut. Heinz Kohut was an analyst from Austria. He moved to the US after the Second World War. He became a neurologist in Chicago and then a psychoanalyst. And he developed a theory of personality which is based on self-esteem, basically. It's a theory that the most important challenge of personality is self-esteem regulation. And that when people have not internalized an adequate sense of self that is robust and resilient, then they do desperate things to bolster their self-esteem. And people that need to do desperate things to bolster their self-esteem are suffering from narcissistic personality problems. Now, Kohut's view of narcissistic problems, which was much broader than the narcissistic personality disorder that got coined in the DSM, like NPD proper, which is the arrogant, haughty, grandiose, cocky, seeking admiration, that sort of obnoxious, haughty, arrogant personality. He also would have considered avoidant personality or depressive personality a disorder of self-esteem. He identified many different narcissistic personality disorders,
Like severe people pleasing and
yes, exactly,
dependent personality and things like that.
right. He would have also felt that those are
I would imagine that
self-esteem issues.
there's two ways of coping with narcissistic injury. One is to get everything you need. Like if you were jealous as a little kid and that was dismissed or ridiculed, and you never had the opportunity to experience your jealousy properly and cleanse, regulate through that jealousy, then I would imagine that you can do one of two things to cope. You can either make sure you get everything you ever want, so you become narcissistic in the sense that you'll just maul anybody over to get your needs met, or you'll completely suppress them and say I don't need anything, but then create some other kind of neurotic behaviors.
Right. So you're actually, I mean, that's really interesting. I think that you intuitively actually have more of a drive theory view of it, the way you're describing it. Kohut described it differently. What he saw as the needs were actually the sense of self that gets reflected through relationships. And then later, the sense of self that one aspires to through admiration of people that have the values and attributes that you want to. So what he saw, people that lack self-esteem are people that they've had impoverished relationships where they're not experiencing people that reflect love, enjoyment, admiration. I would say enjoyment is the best overall word for the first series of these, that it is a normal and vital experience that we feel that people enjoy sitting with us, listening to us. They enjoy our voice, they enjoy our appearance, they enjoy our ideas, they enjoy our thoughts, they enjoy our humor, and that they let us care for them. When we care for them, they enjoy us caring for them. This is what loving parents succeed in doing with their children.
Dan Hughes, who's a big attachment guy, he used the word that really resonates with me. I always use that. He said that you're found to be delightful. Your parents find you delightful.
Right. So that's very consistent with how Kohut viewed this. And then later in childhood, so what he called those relationships were mirroring relationships. That was the term he used for them. And then later in childhood, he identified what he called idealizing relationships. And what it is it's the need we have to identify people that we really look up to and we want to grow up and be like. And they kind of represent the best we can possibly be. And the way he diagnosed narcissistic problems with his patients is actually interesting. He didn't look at their behavior out in the community and look at a checklist phenomenologically the way the DSM does. He looked at the way they attach to him. There are some patients that sort of want to impress him very desperately, and they want him to admire them, and they want to hold court in your office. There were other patients that really admired him and wanted to be like him and wanted to know everything he thought, and so so that he looked at the transference to make the diagnosis of narcissistic personality, which is just not how we think of diagnosing narcissistic problems. We think of it as a checklist of behaviors. And and then the final theory of personality.
Nachum, can we take a question, or would you rather?
Sure.
Okay,
Sure.
Go ahead, Heidi.
Yeah, I'm just curious because we talk about all these, theories, learning, observation, attachment, could it not be hereditary, a personality disorder?
So I will get to that. But right now we're talking about the theories of development that have to do with nurture, and I will get to that also. When the final view is attachment theory, actually grows out of object relations and psychoanalysis. The founder of attachment theory was John Bowlby. John Bowlby was an analyst. He was trained with object relation psychoanalysts in London. And then his research partner, Mary Ainsworth, and they set up experiments. Those experiments have been replicated and modified, and they developed a sense that a very young child, like an infant, very early in life, so this is like, before 2 years old, already has developed a way of attaching to their caregivers. And when children are in distress, what they do to soothe themselves with their caregivers has immense significance for their personality the rest of their lives. It's predictive of a lot of personality problems. So the experiment that they did, you can actually see these experiments on YouTube. You can look up The Strange Situation. That's what it's called. But they basically took infants and put them in a waiting room, and they had them in there with their mother or another caregiver, usually their mother. And there'd be a child sort of playing on looked like a doctor's waiting room in a pediatrics office. And they'd be playing with toys at their mother's feet. And then a stranger would come in the room. They would kind of look at the stranger curiously. Then the mother would leave the room for 1 minute. And most of the kids would sort of have a tantrum when the mother leaves. And by the way, that's healthy. That's normal. And then when the mother would come back in the room, how did the child regulate himself or herself? And how did he or she use the mother, attaching back to the mother, to soothe him or herself, to regulate him or herself? So they identified these different patterns of how children do or don't soothe themselves with the mother and how long it takes. And that was called the attachment style. And they were able to correlate one's attachment style with different personality problems later in life. So this is, now I should say there's really that's 6 theories. There's really another theory, which I will call trauma theory. But trauma theory might incorporate lots of components of the other theories. And the other difficulty about trauma theory is that a lot of traumatologists believe that personality disorder diagnoses are an error and that they are due to the lack of recognition of trauma. For example, there are a number of traumatologists that believe that the whole conception of borderline personality is
Complex
essentially
PTSD.
an error. What'd you
Complex
say?
PTSD.
Yeah, like so, complex PTSD, or the term that's used by Bessel van der Kolk, is developmental trauma disorder, but it's essentially the same thing. And that would be like a better, and that, basically, I also saw a long interview with Judith Herman where she felt that borderline personality is an inappropriate diagnosis. So where trauma fits in is a little bit complicated, but basically that many or most or all personality problems, depending on how like extreme the view is of a traumatologist, are explained by trauma, and that we have to look to trauma in terms of seeing the origins of personality. Now, somebody talked about the hereditary nature of personality disorders. To my knowledge, there's really only one personality disorder that is inheritable, like that we see a really clear genetic concordance, and that would be the schizotypal personality. The schizotypal personality disorder is a cluster A disorder, and it's characterized by people that are aloof, they have odd ideas, they are really reticent or reluctant to engage in relationships. They don't seem to have lots of interesting passions that they pursue. So they have abnormalities in their interpersonal relationships. They have abnormalities in their cognitions because they have odd ideas. They tend to be into conspiracy theories and believe weird things. These are people that might tend to like believe that they were abducted by aliens at one time, or they believe that there are weird things happening because of fluoride in the water or no fluoride in the water, or they are really suspicious about a lot of things. They believe that they can recognize patterns that other people don't see. And that seems to be very inheritable from, we just see it's correlated in families. Like lots of people have it, like many other genetic problems. But the other thing is that the schizotypal personality is probably, this is like my opinion about it. Like I'm convinced, I didn't do this research. I've read this research. I'm convinced by the research that it's probably a form of schizophrenia. Schizotypal personality is probably a mild form of schizophrenia. It used to be called simple schizophrenia, and it runs in families just like schizophrenia. What is very heritable would be, for example, having really high anxiety, having really intense anger, having really having difficulty with attention and concentration, like in ADHD. There are a lot of traits that are very inheritable. And then those traits put stress on the personality. So you will see people, for example, let's look at another disorder. If we think of autism spectrum disorders, it used to be called Asperger's, autism spectrum. People with autism spectrum have a lot of personality problems. They do. And we can probably find some things that are generalizable about their personality problems. A lot of kids with autism were very bullied. A lot of kids with autism have a lot of trauma from being bullied. A lot of kids with autism have a huge amount of anxiety in their social interactions. A lot of kids with autism are really not skillful in their social interactions. So they get rejected. People think that they're weird. And some of them don't know, but a lot of them are very sensitive to being rejected, and they know that people think that they're weird. So, we can see a lot of personality difficulties that people with autism will develop. Some of them seem to be directly due to the autism. Some of them seem to be because of secondary problems of socialization that get embedded in their personality. So I think autism is like a really elegant example of how common it is that you have biology influence your personality, and then also your personality influencing your biology. We know that people that are vulnerable to narcissistic problems are prone to depression. We know that people with obsessive-compulsive personality traits are really prone to OCD, depression, and anxiety. So it sort of moves in both directions. So are personality disorders inheritable? Mostly not in terms of like really inheriting the whole disorder, but yes, in terms of inheriting traits in your temperament that give you a lot of challenges with your personality. So back to the original question with all of that. Whatever happens in parenting and the culture and your upbringing and trauma and your experiences with your parents and your siblings and your friends and the community you happen to be thrown into, and whether your skills and abilities are valued by your friends or whether they're not. I mean, I think one of the best places, like if I knew that I was going to be born with autism spectrum illness and I had to choose a place to be born, I'd probably choose Lakewood, New Jersey. Because if I have tremendous Sitzfleisch that I can sit for like 30 hours in a row studying Gemara, and I'm like excellent at absorbing huge amounts of theoretical information at once, but I'm like not so adept at being cool and suave in my sense of humor and joking around with people, I think that people with traits like that do a lot better in Lakewood than they do in secular communities. I think that they do. You know, I think that there are some cultures that are really tolerant or admiring of certain traits and don't pay attention to other traits. I think a lot of the things that are thought to be like really cool and admirable in some religious communities are considered superficial and not important. We look at other things that we think are really important for character. I think that there are a lot of people in our communities where we arrange marriages for kids that do get married, can have happy marriages, can have happy relationships with their kids. And in a lot of other communities, they might not have gotten married very easily. You know, I think that there are really differences in different cultures. So, so whatever in your parenting does, you know, causes problems in your interpersonal relationships, in your impulse control, in your schema, in your affectivity, whatever the combination of those biological and nurturing traits and their interactions are, that's what forms your personality, and that's what also would form personality disorders.
So I want to ask you though for a minute about, let's say, obsessive compulsive personality disorder, which is a cluster C personality disorder.
Right.
OCPD, for those who are not familiar, are people who have extreme rigidity, need things to go their way and be a certain way, inflexibility, and if I'm not mistaken, poor insight, you know, emotional or affective insight. These people need to be in control of everything. They do very well with very rigid rules and expectations and regulations. They're very regimented, usually.
I don't know if they do well with it, but they seem to impose very rigid rules on themselves and others. I don't know if they do well with it.
That's how they know that that's how they feel sturdy and on their feet. If they have these rules that have to be followed, they know exactly what has to be done, and that somehow calms them down. How much of that, I mean, that just when if you observe children, can you sort of predict that, oh my gosh, this little child has components of rigidity, components of inflexibility, and will eventually grow into somebody who may have OCPD? Are there not biological traits that just seem very characteristic of certain personality disorders that seem less about nurture and more about nature or biology?
So OCPD, I really think it's both. Borderline personality, I also think is both, by the way. That you see, first of all, you see high levels of anxiety in people who develop obsessive compulsive personality. You also see people that are really afraid of their aggression. They're afraid of anger. They're afraid of aggression. And fear of aggression seems to be one of the foundational organizing principles of obsessive compulsive personality and also of OCD. Now, OCD is definitely very genetic. It's not all genetic, but we do see it in families very strongly. Mm-hmm. And we do see that people who have OCD have a higher preponderance of obsessive compulsive personality organization as well. I mean, they're different from one another, but they do travel together very frequently. We do see some people with obsessive compulsive personality that do not have obsessions and compulsions. And we also see people with OCD that don't have an obsessive compulsive personality. It's not everyone, but there's a subset that really have both. So I think that children who are at risk for OCD, I'm sorry, for OCPD, are children that are really, really terrified of people getting mad at them. And they're really terrified of getting in trouble when they're mad. And the other thing that seems to be correlated are really, really smart kids, really precociously smart kids develop a lot of obsessive compulsive traits because they are able to kind of like notice and regulate their minds very early. And that's like a very, so one of my kids was a precocious speaker. She was speaking in complete sentences at 1 year old. And my mother spent the day with her listening to her in her room. And she would walk around her room at about 1 year old, and she would say, shoes, don't eat shoes. Wipes, don't eat wipes. Like she could hear, this is like her like primitive superego just forming, at 1 year old. And kids that are really, really bright, they can notice. And so you see people with OCPD, they really try to control their minds in a certain way. Like the rules are rules that are imposed to not feel anger, not feel passion, not feel uncertainty, not feel danger. So that's something that was really learned very young, and it was really adaptive when they were very young. But it was so successful that in some of these individuals, that was really held on to. So I think that we can see kids that are headed in that direction, and I think what we try to do is we try to help them be more flexible, try to help them understand, like, no, like you have that emotion, it's okay. We try to be tolerant of their anger. By the way, it's very hard to be tolerant of our children's anger. No one likes angry kids. Angry kids are really unpleasant. So angry kids get scolded for being angry. And kids with OCPD, they're really, really afraid of being angry. They're really afraid of bad consequences.
So yeah, well, I was going to ask you about that. They're afraid of you said they're afraid of their own anger. So the way that just help me work this through with me. So the way that their obsessive compulsive personality deals with it is by what? By somehow regulating that they shouldn't get angry, by creating all kinds of boxes and rules that they'll have to stay in.
Yeah, it's like they want to put their minds on lockdown, and they want to put themselves on lockdown. If I will never ever allow myself to go more than 2,000 miles in my car without changing the oil, then I know that I'll never go over the 5,000 miles that my car is going to get bad. And what I'll do is I'll set up an alarm when my car goes over 2,000 miles and the oil isn't changing. I mean, it's a fear of losing control, of making mistakes, and it's a discomfort with affect. Right. Affect feels threatening. Affect feels dangerous. Affect feels unpredictable. Affect feels like the sky is falling and all hell's going to break loose. And so it's kind of keeping your affect on lockdown. And obsessive compulsive defenses are the defenses that really squelch out affect.
So the same things apply with the fear of going to hell, the fear of getting punished, the fear of all kinds of religious beliefs that people.
Those would be the cognitions, right? Those would be the cognitions and the schemas that come along with obsessive compulsive personality. So some of them might be learned. Like I do believe that in fundamentalist, austere, strict environments, there are more people that have obsessive compulsive personality. But I also think that people that have obsessive compulsive personality internalize the most harsh Musar, the most harsh, midrashim, the most harsh, and other people, they're kind of like, yeah, that Rebbe was like kind of crazy about, talking to us about Kedusha. He has a thing about Kedusha. Right. And they can sort of turn off their hearing aids.
They can recognize that he was extreme.
Yeah.
Internalize it, they kind of scoff.
Exactly.
Yeah.
So I think there's a higher number of people that do have these, not just Orthodox Jewish cultures, other religious harsh cultures, but I also think people with that tendency are more vulnerable to internalize those messages.
Yeah. And you've made this, we spoke about OCPD a number of years ago. You can look at the Mondays with Maisha YouTube channel and find the video there. But you and I discuss this, and I know that you make an argument often about whether it's the chicken or the egg, whether people who have these rigid things develop it because of their religious beliefs, or people really get excited. People who have, obsessive compulsive personality traits gravitate towards religion because there's certain rigidity that they can subscribe to, so to say.
I mean, look, it's definitely both. It's definitely both. I think that we see higher amounts of OCPD and OCD in very, strongly rigid religious fundamentalist communities. But I also think that people that are going to have OCD or OCPD sort of wherever they would grow up are going to have the hardest times in those communities. They're going to internalize the harshest. I think
they're going to suffer the
chicken
most.
and an egg. They're going to suffer the most.
Yeah, we certainly see that. We certainly see that. And they're also very, I mean, it's very difficult to work with that because it seems that the motive to protect themselves is way, way greater and supersedes the motive to become more flexible and have engage in a better life.
Now, I wanted to explain something about splitting, because splitting is something that's really hard to understand, and it's not taught well. And when I say it's not taught well, I even mean in advanced training programs. A lot of people see splitting as though it's a stage of like pre-operational thinking, like black and white thinking, like a childish way of looking at the world as black and white. That's not really what splitting means in terms of object relations theories and borderline personality. Splitting is a way of keeping yourself regulated when you feel threatened with losing relationships. So a neurotic personality organization, which is the healthiest level of personality organization. This use of neurotic means healthy when I say neurotic. The neurotic level organization is a person who really, like, the prime directive is I want to maintain my relationships. So let's say that I think Moishi's mad at me that I didn't let him continue on one of these points and I interrupted him. So after the talk, I'm worried. I'm going to say, Moishi, I'm sorry that I interrupted you. I was so excited. I hope it went okay. I don't care if I'm right or wrong. I care about Moishi being my friend afterward. If Moishi is mad at me and says, Nachum, I really need to talk to you about how you handled yourself in that talk, Moishi, I'm sorry. I'm already sorry before I hear what went wrong. I just know that I'm sorry because I want to maintain the relationship. So I don't need to, I am more worried about Moishi being my friend than whether he's correct about what happened in that call. Now, you can be too neurotic, and then you can become like a schmata that everyone steps on. That's when you're like very neurotic. Splitting in a borderline organization is very different. In a borderline organization, I am so distressed about the possibility of losing someone I love that if Moishi, I think, is unhappy with me, then I protect myself by realizing or concluding Moishi was never my friend. Moishi was using me to have me on the show. Moishi never cared about me. Moishi was using me. Moishi is a jerk. I turned Moishi into like a demonic villain in my mind. And then I'm not losing a person that was friends with me. I didn't do anything wrong. I don't have to blame myself for losing this relationship. I kind of poison the relationship to spare myself the threat of the loss. And that's what splitting is. Splitting is when you handle loss by actually, it's like, you can't fire me because I quit.
Yeah, they say that you kick the other person out before you're afraid that they're going to kick you out, so you kick them out first, and this way they were the bad one and you're not the bad one.
It's always maladaptive. Okay. This is a terrible way to go through life. You can't repair any relationships. You can't grow. You can't apologize. You can't realize what you've done wrong. And you just collect one betrayal after another. And it's a very Farbisan manner of going through life. And that's, I think, the central organizing sort of defense of borderline personality. It's a defense. Now, the other thing that happens on the other side of splitting is that if I'm really desperate and lonely and heartbroken all the time, when I first meet Moishi, my gosh, I have a new friend. He's like the greatest person in the world. It's like lechem in hashamayim. Like he is so wonderful. Finally, I have someone that understands me. He's just like me. I want to be exactly like him. He's like me. We love each other. We understand
And
each
then
other.
you do everything to make this work
Right.
because like that's idealization, right?
That's the right. So the idealization phase and the splitting, it's not a cognitive problem in the inability to reconcile black and white into shades of gray or man. It's not the inability to man, it's the inability to tolerate loss and aloneness. In order to apologize to Moishi, I have to realize, wow, I might have gone too far here. I might have done something wrong. I have threatened a relationship that's important to me. I need to attend to that. Like it's the inability to like do that. And so I think that that's actually helpful. And even if someone with a borderline character structure also has developmental trauma, also has PTSD, also has dissociative problems. By the way, dissociation is a symptom of borderline personality. I think that's actually very helpful. And it is what you end up working on in the therapy. I mean, the entire therapy is about helping
Interpersonal,
someone.
it's very relational and interpersonal.
Yeah, it's a relational therapy, and it's about maturing through splitting. It's not really cognitive. You'll do a lot of cognitive work because you need cognitive work to do emotional work also. It starts with cognitive work.
But
So
you're talking about like how do you experience me? How are you experiencing me? How do you experience me now? How do you experience me yesterday? How do you experience me tomorrow? How do you experience us?
right, and that relationship is what's the healing vehicle. You know. Now, by the way, the
you
relationship.
could help them
Look,
regulate. You could co-regulate them and regulate and question them and look
well,
at their.
you can. I'm not even saying that. I'm saying like they're going to deregulate because of your relationship. They're going to deregulate when you're on vacation. They're going to deregulate that you didn't have a time for them. They're going to deregulate that you showed up late. They're going to deregulate that you double booked and missed their appointment. They're going to deregulate that you had a bad day and you said something kind of mean. You made a joke and it wasn't very funny. It was like an annoyed joke. They're going to deregulate, but it's a therapy relationship. It's a professional relationship. It's not like their other relationships. And you're going to be able to recover from that differently than people recover in their social relationships. So how you're going to recover from all of those emotional storms that you did help create, by the way, that's how the relationship is going to heal. And it's a long treatment. I mean, it's on average a 10-year treatment, I would say, on average. It might be longer. It's usually not much shorter, but a successful treatment of borderline personality, it's at least a decade.
I want to take a question from Yankee. This is very interesting, the borderline treatment discussion. And you know, I guess what keeps coming around in my mind is how many people struggling with borderline personality disorder can actually survive 10 years with the same therapist. But let's go to Yankee. Yankee, ask your question, and then we can go back to that.
So first of all, thank you, Nachum. This has all been very insightful and very interesting and eye-opening to me. And maybe a segue to the current discussion. People that are married to people that have a personality disorder, and maybe specifically in cluster B. What are they setting themselves up to? What type of marriage, what type of life would they have?
Well, it varies tremendously because some people with personality disorders and certain personality disorders can actually be much worse to their spouses than they are to the rest of the world. And some people can be much better to their spouses than they are with the rest of the world. And also there are, various gradations of severity with personality disorders. In terms of treatment, when someone's in a marriage, there's usually a lot of psychoeducation for the spouse. There's usually couples work. And I think that the therapist has to have in mind that, listen, we can't really wait for you to resolve all of your psychological issues for you to start treating your spouse different in a natural way. If you don't stop doing this in your marriage, you're going to be divorced, and you should be divorced. Like, your spouse should not have to put up with this from you. You should really be divorced. So I mean, I'm happy to work with you for 10, 20 years, but you cannot think that your wife or husband is going to be married to you for 10, 20 years till you're like totally healed inside out. Like, you have to start acting very, very differently yesterday in this marriage. So I think that's, by the way, I think that's true of many things in psychotherapy. You know, like the idea that we don't give advice and we let people come to their own conclusions, it's only true to the degree that it's not going to be so damaging to their whole lives or even to the ability to stay in therapy.
Crisis safety and crisis intervention and all these things. And it's also, when you talk about not giving advice, here you're not per se giving advice. You're sort of
you're giving directives, though. You're saying, like,
you're telling them what's gonna happen. And if you're in therapy because you want to stay married and you want things to be better, my professional knowledge is that this is what's going to happen unless you do this. And what we see that
there are people with borderline personality organization who actually are good to their spouses. There are people with borderline personality that torment and torture their spouses. There are people with a narcissistic personality that are actually very kind and good to their families. There are people with a narcissistic personality that are tyrants to their families. It's really hard to use the diagnosis to predict what the problems will be in the relationship. And the other thing is that, they're married already, especially in our communities. They're already married. And we know how they're acting in the relationship. So we already see what they're doing. The question is, like, what is the prognosis for how long this is going to take to get better? So I think, you sort of you do an assessment, you do psychoeducation with the spouse, probably recommend the spouse has a therapist. They'll probably need to also be a marital therapist at some point, maybe earlier, maybe later. But, look, let's see if in the next 6 months, there are major, major improvements in how your spouse is acting in the marriage, and that this feels like the kind of marriage you want to stay in, and the kind of marriage that you think can be okay for your children. Like the damage your word divorce will do to your children. Of course, what about the damage that years of really severe distress and dysfunction and abuse in the house will do to children? So I think you give a finite period of time, maybe 6 months, to see how much improvement there will be in 6 months. You also look to see, in terms of predicting, it's very hard to predict who will change, but we can predict who won't change. There are some people we know they're not going to change. There are people that, if I do something harmful to you, and I feel so bad that I did it, and I'm so apologetic, and I really do everything I can to stop myself from doing this ever again, there's no guarantee that I'm not going to do it again. But what about someone that doesn't admit they did something wrong? They apologize that you feel this way about me. Like, that's the apology. I'm sorry you feel this way about me. I'm sorry that it hurt you so much, that this mild thing I did hurt you so much. And then the apology tends to be like putting down the spouse. And we don't think they're making any commitment or effort to change. We know they're not going to change. We know that person's not going to change. So I think we look for the signs of potential change. We look for actual change. We think about, like, how bad this is. And then ultimately it's, up to the spouse to what degree they want to be in this kind of relationship. I think that in a community where people don't feel that they have the authority to decide to get divorced or not, it's like up to the dayan or up to a bezdin or up to their parents or up to a whole bunch of other people, then, it's, then, like, you really have to, there's a lot of advocacy in terms of making recommendations to all those other people when you're doing mental health work in those communities. And that's a different boundary than in, like, the modern Orthodox community, where people don't get divorced based on advice from parents or a dayan. It's usually there's more autonomy. I'm not saying one's better than the other, but I think it's the reality of these communities. So it's a really complicated question you're asking. Those are some of the factors, but we look at how bad it is, and we look at whether the person seems to be really motivated to change, whether they really understand things. whether the spouse, how bad is the spouse suffering? How much abuse is there? How bad is the abuse? It's very hard based on the diagnosis. I think it's really based on the elements of the distress and the dysfunction. I hope that sort of answers the question.
One small follow-up.
Yeah.
In the beginning, you said that you started off saying that the spouse can sometimes treat their spouse differently than they treat other people in other relationships.
For better and for worse, yes, definitely.
For better, right. Exactly,
yes.
For better or for worse. Now,
right.
How can even a skilled marriage therapist differentiate the personality disorder from just marital conflict?
Well, the first thing is I don't know how important it is to make the diagnosis of a particular personality disorder in the for the marital therapist to do that. I think a skilled marital therapist can detect who is workable as a couple and when the dynamic is going to change based on the interventions of the marital therapist. And that it's true that certain personality disorders are going to be more resistant to therapeutic change and certain severities of them. But you don't need to like identify the personality disorder. You're doing marital therapy and you see the impact of that personality disorder and those traits and that rigidity on the marital therapy. There are some people with narcissistic personality disorder, and they, in order to feel better about themselves, they become highly motivated to be the best spouse ever and the best marital therapy patient ever. And they might do really good work in marital therapy. It might still be really annoying to work for them or to have them, as a partner in business. But they might do really good work in marital therapy. There are other people that, just the level of arrogance and the inability to tolerate admitting you're wrong is going to be, and it's going to interfere with the marital therapy. And so I don't think the marital therapist has to make the diagnosis as much as they just have to see the impact on the work. I think skillful marital therapists really can tell within like 10, 15 sessions couples that are going to get better, maybe even earlier than that. But I really do think 10, 15 sessions, good marital therapists really have a good prognosis about whether this relationship is going to improve or not. And so I don't know that the diagnosis is as important as seeing how the interventions work in the room. It's related to the diagnosis, but it's not, that's not the essence of the prognosis is not the diagnosis, I think.
I do. Go ahead.
Jump in and answer Yankee something? I'll do it quick. I'm doing marriage counseling. I had a couple where the wife was literally DSM-5, like borderline personality disorder. I've seen it pretty early. She would abuse him and manipulate him, and everything happened in front of me in session. And I strongly suggest that he sees a private therapist and gains a voice. He would be quiet, and then break out crying, feeling like he wants to leave the marriage this moment, but then never really able to share with his spouse what's happening because he would just open his mouth and then she would put him down to pieces that he would never open his mouth again. And as soon as I spoke about him learning to have a voice or whatever, there was the end. And the wife said, she's not a good therapist. We are not going back to her. So lots of them would end up that way. And I don't know what's with them today, but I'm just saying like that can happen.
Okay. Does anybody else have any questions or comments before we close up?
No one knows what happened to Idy's couple. Have any of us not met Idy's couple? By show of hands, who didn't meet Idy's couple after she fired them, or they fired her?
I do have a question. Is it possible that a highly sensitive child, extremely highly sensitive child, being raised by average parents, nice parents, competent parents, but parents that don't have any clue as to how to raise a highly sensitive child, could that child grow up to develop borderline?
Well, a highly sensitive child is a vague term. Sensitive to what? Sensitive how? What happens? But there's no question that there are some children that look, we look in the same families. We see in the same family that there's one child with really severe personality problems, and the rest of the kids in the family seem to do pretty well in life. And they will say, yeah, like, this kid was always like really, really offended, felt really, really left out. And it doesn't seem that it's like, one theory is, oh, well, maybe mom was really depressed between ages 0 to 2 for that kid. But it doesn't seem like the history suggests that. It does. So I think you're right. I think that there's, a mismatch. There are some parents that have skills that are well suited towards some kids. There's some parents that are so skillful that they could do the best with sort of like any kid. And there are other parents that, there are some kids that are so resilient, it seems like they thrive in any family. And usually we have situations that are kind of in between. So I think what you're saying sounds plausible. Would it be borderline personality? I don't know, but it would be personality difficulties. The idea that it would be borderline personality, I think people with borderline personality often have been pretty severely neglected, emotionally neglected.
But also, can I just caveat?
Pretty severely abused, and often have temperaments with lots and lots of rage and anger, I think, and then an environment that isn't able to handle it.
I think the caveat to that, and correct me if I'm wrong, is I think we have to add the word perceptually. They weren't always necessarily severely abused or neglected as much as they were perceptually abused and neglected. And that doesn't necessarily mean that they weren't, but it does mean that it was very subjective. And somebody else who does not have the same temperament or personality might not have reacted the same to that, may not have had that same perception of the abuse and neglect. I think
again, like I'm saying, I think it's a combination of the following: abuse, neglect, a very delicate, fragile temperament, and a lot of rage. I'm not saying it's all four of those things, but there is a very high correlation of abuse and PTSD and complex PTSD and borderline personality. There are some people where that does not seem to be the case. And actually, you see those kids actually, despite having borderline personality, they have good relationships with their parents. There are people with borderline personality that will say they were never abused, and they have really good relationships with their parents, and they feel bad that they've been so difficult, and they feel bad that they get so mad at their parents. There are kids like this. We've all met patients like this, but there is a lot of abuse. So I've met people with borderline personality that don't even have perceptual abuse. They don't believe they've been abused.
Right. My point is that the personality disorder that's developed or is formed can be with abuse that was strictly perceptual because of how sensitive they are. It does not have to be through objective abuse.
I think I use different terminology than you, but I understand what you're trying to say.
That's okay. Well, Nachum, whether or not we agree on everything, whether or not I think you did a good job, I'm still your friend. So I just wanted to put that out there. And it just happens to be that I enjoyed this talk immensely, as I do every one of yours. I try not to abuse and overuse you, but I really hope that you'll do this again and we can continue talking. Thank you, everybody, for joining. This was fun. For those of you who will be at the Nefesh conference, you can pick out Dr. Klafter. He's not hard to, usually it's something about the sweater, but he's not hard to find.